You do a lot of facial fillers.
I do, Randy. I do a lot of facial fillers and a lot of neuromodulators such as Botox and Dysport and Xeomin. I really think that these products, when done well, can really help that patient that is in their late 30s, early 40s, not quite ready to undergo a surgical procedure, but really is okay with coming back every 9 months or so, or 4 to 5 months or so, just to maintain that freshness.
Is there a lot of technique to this? Because everybody seems to be doing it these days. Dentists, really?
It is. And
so is it technique or it's pretty easy? Straightforward.
Well, let me say this, Randy. I teach a lot of healthcare professionals on the art of injectables. I have taught all over the country. I've published on these products, and I can say that there is an absolute art to it. And what happens is, I think that too many people approach injectables as a technical exercise as opposed to an artistic exercise. You can do incredible things for patients. Remember, we're only talking about millimeters here when it comes to freshening a patient's face. But if that product is put in incorrectly, or that muscle is weakened, you can make those millimeters look distorted, and you can make a face look strange.
But the problem with fillers, and that's why I don't like them, and I want to hear your response to this, is it seems like it makes people look odd or puffy or weird.
Well, if you saw my patients, Randy, you wouldn't say that.
Okay.
And you wouldn't see that. Your point is extremely well taken. I think what happens is that patients, when the face ages, it starts to deflate. So common sense tells you, well, we have to reinflate it, okay? Well, we don't use air, but we use fillers. But what most people end up doing is they end up filling so much that they take away the natural beauty of the face. And that's the shame behind fillers.
Does that happen in Philly? Because I know it happens here in California.
We see it all the time.
Overfilling.
It's overfilling. And it's really, I think it's really due to, when you spend your life looking at a face like I do, 24/7, you get a little bit of an idea about where things need to go and what needs to be done. There's a lot of people out there that are doing this just because they think it's an easy way of making money. And that's unfortunate, because really
a lot of art to it.
There is art to it. And what happens is that when it's done improperly, it scares people away from it. So really what I do is I prove to my patients that I can do a lot for them for a lot less product.
Okay.
And it's because I know where to place it, I know the artistry behind it, and I know how to have them walk out and have their friends say to them. And many times, my patients will say, my friend said, I really looked good, but they couldn't put their finger on.
So in one day, they could look 5 years younger. I mean, because it happens that day, right?
No question about it. No question about it. You can do it with both.
And it does it cost more? I mean, does it have to cost more to go to a facial plastic surgeon? And do you have a bias that if you're going to do this, you might as well go to somebody that actually could see inside the face, right? I mean, when you look at somebody's face, you know the anatomy.
Yeah.
Does that give you an advantage?
I think that point that you just made there, Randy, is incredibly important. Because of the teaching that I do, I'll get this question, Dr. Greco, where is my needle right now? When they're actually injecting somebody in the face. And that's a little bit nerve-wracking. I'm happy to explain that to the person, but I'm thinking to myself, okay, you're sticking, a needle is like a micro scalpel. And if I take a scalpel and I cut somebody's face, I can tell you every layer I'm going down to, every nerve, every artery.
So to answer the question, do you have a bias that you think that they should probably see a facial plastic surgeon that does this as well? I know there's great RNs out there,
Sure.
but
I'm a little biased.
okay.
Yeah, I would say I'm a little biased. I think.
So look at the results, though.
Yeah, I think. Yeah, they speak. The results speak for everything. But yeah, I do have a bias. I know how much time and effort I've put into this, and I definitely think that a knowledge of the anatomy and a knowledge of the products and teaching and all the experience definitely makes a difference.